Hello friends, Namaskar. I am Dr. Maulik Shah, MD Pediatrics from Malad, Mumbai and your child's pediatrician. Welcome to the series of excerpts from my recent book Nurture Your Neo. And today I am going to talk about hunger cues. So what are hunger cues basically? The babies are quite smart enough to communicate their basic needs of hungriness or hunger. And here we are going to discuss about how they show the gestures by which we can pick up that the baby is hungry. So let's begin. So baby is extremely smart to communicate the basic needs, that is feed. These are subtle signs suggestive of hunger. Making and sounds is one of the commonest early signs. There are other signs also like rooting, sucking, wriggling, flexing the hands and legs, putting fingers in their mouth, and lastly cry. Now cry is not specific of hunger, but yes, that is one of the signs. Rooting means if someone gives a gentle stroke by the finger over the cheeks or the area around the lips, the baby roots the angle of mouth, opening towards the stroke to grab it, assuming that it is nipple. Sometimes they try putting their fingers in their mouth, and if the finger overshoots, they try to approach the finger by rooting their mouth towards overshoot finger stroke. Many of the times they start sucking their own fingers, and one can actually hear loud sucking sound. This kind of sounds. Okay. So these are finer movements and gestures that suggest hunger. If not responded, they start wriggling around the entire body and sometimes moving hard all four limbs, like either cycling movements or repeated folding and extending the joints. And if they don't get any response on the above any method, finally starts crying. Now try to catch up with the above signs and avoid the child reaching to the crying phase, as that becomes extreme and the baby might get aggressive and might not feed well. That's all my friends today. Thank you. Namaskar.